Welcome to the Dr. Ed Show. I'm Dr. Edmund Sulkowski. You know, we don't diagnose here, nor do we treat, but we hope to educate and inform, hoping to empower you to be in charge of your own health and wellness. We provide a lot of education with a lot of our guests to help you in your well-being. You can listen to me every Saturday morning live on AM 1250 The Answer from 9 a.m. to 10 a.m. And we have a good show about health and wellness. And you're able to call in and actually talk to the guests every Saturday morning at 9. Also on 92.5 FM. And then, of course, you can go to rumble.com, Spotify, all those social media things. Search the Dr. Ed Show. And then we hope that you subscribe and then you share. We have a wonderful guest for you today. It's Mr. Tom Yakopin from West Penn Life and Health. But we're talking about something that's probably critical for a lot of our listeners. And that's, what do I do when I become the age of Medicare? How do I pick a Medicare plan that works right for me? So we're going to go into depth about that because it's so involved and you can make some great mistakes. We want to avoid those. We'll be back in a minute with Mr. Tom Yakopin. Welcome back to the Dr. Ed Show. We're here with my special guest, Mr. Tom Yakopin, founder, owner of West Penn Life and Health, and we're discussing something I think is so critical. When you get to that age where you're looking into what Medicare plan you have to sign up for, you're just inundated with information that's actually, I think, is overwhelming. And you turn on the TV, and what you see on the TV is, call this number. Well, that's just a call center, and they're not going to help you. They're just going to refer you, and everybody's making a buck here and a buck there off of that. You need to have some real information because those choices that you make with Medicare can really impact what happens to you if you need insurance and you've picked the wrong plan. And we have a specialist here, Mr. Tom Yakopin, to inform you guys on what plan to pick, and how to go about choosing the right plan.
Right on.
So Tom, before we talk about these plans and really what Medicare is, what's the difference between health insurance and health care?
Right. So health care is kind of, it's pretty simple if you think about it. It's what your doctor does. It's what your dentist does, your anesthesiologist. These are care providers, practitioners, right?
They're looking after your well-being.
They're looking after your well-being.
Diagnosing and treating.
That's correct. And insurance, health insurance, and there is a lot of confusion about that today, you know, what health care plan can I buy or whatever. And the truth is that insurance is not health care, and health care is not insurance. Insurance is a product, it's a financial tool designed to help you finance expensive care, right? So I like to make that distinction, and I like to remind people that there is a big difference between your health insurance and the providers and the care that you receive from your docs. In fact, I was on the phone yesterday with a friend of mine asking about, she's not ready for Medicare yet. She's under 65, looking at health insurance plans, and some of the premiums out there that people are asked to pay are pretty steep, pretty hefty. Medicare, I think it's much more affordable, but she was blown away to find out that there are doctors, and I think you're friends with one of my doctor friends, Rebecca Plute.
I'm also a patient.
You're a patient, you know, and there are doctors that will provide care, outstanding care, with no insurance. And I often recommend people look into that. It's a concierge type service. I call it direct primary care, and it's direct because you're cutting the insurance out of the deal. I pay a monthly subscription to Dr. Plute, Paragon Personal Health Care, and that monthly subscription entitles me to doctor visits, various services, and tests that she can do in-house, blood draws, things of that nature.
It's actually personal care.
It's personal.
Yeah,
you know,
she's been on this show several times, as well as the Dr. Ed radio show.
And I always like to point to direct primary care as an example of one of the purest relationships between a caregiver and a patient. You know, there's no middleman there. There's no insurance company mandating how they, you know.
Gee, you just bring up a fantastic point, Tom, because the insurance company and patients don't realize this, mandate how we treat and when we treat.
It's horrible.
And it's almost to the point of being ridiculous and not beneficial for the patient. And we often have to fight in order to get treatment done.
And I'm not a fan, Dr. Ed, of what insurance has become today. You know, it's unfortunate because I'm in the belly of the beast. I was just thinking about this yesterday. I've been licensed for 38 years, okay? Which kind of gives away how old I really am, right? I mean, I've been at this a long time. But insurance, when I got into the business in 1985, health insurance was so radically different then from what it is today. Meaning, you know, the insurance company was over here financing major medical conditions, things that got out of hand for the consumer. The caregiver, whether it was your doc, your specialist, your hospital, there was no relationship between the caregiver and the insurance company. The insurance company was, the health insurance was a product that the consumer would buy to indemnify themselves in the event they had a loss.
So much like you're driving down the road and you have car insurance, you're not using your car insurance on a daily basis. If you have some mishap, an accident, whether somebody hits you or you hit somebody, then you have that so that you're not in financial ruin.
Bingo.
And isn't that how we should look at health insurance?
Well, you know, it's exactly how we should look at it. And when we don't look at it that way, or when it becomes something other than what I believe it was designed to be, which is a financial product to manage risk, what happens is when you start insuring or attempting to insure every sniffle, hiccup, nosebleed, counseling, wellness. I mean, think about it. We're insuring preventive care and wellness, okay? So what happens? Back in the day, in 1988, I can recall a family of 5 could get a $500 deductible major medical plan for $300 a month, okay? Look for that today. It's not out there. A family today, if they're not receiving subsidies, right, which is a whole other discussion, a family today, it's not unusual for a family to be asked to pay $1,500 a month for insurance.
Well, I think when I came to you some years ago, I was paying $1,700 for my own health care and never using it, fortunately.
And those plans are front-loaded with huge deductibles. I mean, you know, and I'm not the smartest guy in the room here, but, you know, I can do math. And, you know, if you're paying $1,500 a month for an insurance product, that's what, $18,000 a year? If you do that for 10 years, that's $180,000 you've got in insurance premium to protect you from a large medical bill. Well, how large are medical bills? I mean, you know, a heart attack, you could probably get in and out for 60 grand. So right now, unless you're getting subsidized in the under 65 market, the cure, meaning the idea of buying your own insurance, is literally just, you're paying over a period of time what would otherwise be this, you know, risk that you're trying to hide from. It really doesn't make sense.
You're making a point. So the insurance companies and the pharmaceutical companies and the hospitals, which now own all the doctors,
Correct,
are all intertwined. They're all.
It's a mess.
It's a mess. Yeah, that's exactly the best way to phrase it.
And going back to our discussion today with Medicare, you know, there are 2 major ways to get Medicare insurance today, right? Or to utilize your Medicare benefits. One way, and by the way, this is what I do in our office, and this is what Janice Steed would do in my office, this is what Shernice Wilson would do in my office, is that we first sit down with the consumer and educate them, okay? Because there's a lot of misinformation out there, you know?
And that's what your offices and you and Janice and Shernice are fantastic with. I know when I came to you, my complaint was I was spending all this money and really never utilizing the insurance because I take care of myself. I needed it there because if something happens, I needed so that I didn't end up in financial ruin. And I expected to walk in your office and say, here's a plan, sign your name on the paper. And I was there for an hour and a half. And in fact, you know, I said, hey, Tom, I got to go, you know, because you were giving me all these scenarios and designing a plan that was perfect for me. Now, that was outside of Medicare.
Bingo.
But, and you ended up, what you put together for me saved me at least $1,000 a month.
Yes, it did.
You know, and that was an incredible saving for the same coverage. In fact, I ended up having to use it, and really out-of-pocket expenses were nil, pretty much.
That's correct.
You know, so But when you look at this coming into this age that you're signing up for Medicare, there is Medicare A, Medicare B, C, the alphabet soup of Medicare.
It is.
And it means nothing to you. How do you know what you're doing or what you're getting? And if you call these, I see these advertisements on TV, you call these centers, they're giving you nothing. You need to sit down and talk to somebody that knows.
I would. Yeah.
And knows you personally. And you asked a ton of questions of me.
Yeah.
To come up with the right plan. Mm-hmm. So, all right, I'm now Medicare age. Mm-hmm. What's my first step in contacting you?
Well, the first step would be to call the office, 724-228-7187, or visit us online at westpennlife.com. You can book an appointment using an online service there, or call. I would call, schedule an appointment, come in. First thing we're going to do is sit down on an initial consultation, which we sell nothing on the initial consultation. And I let people know when they sit down at the conference table, we're going to spend about an hour together, 45 minutes together. We're not going to recommend a plan. We're not going to sell anything today. We want to educate you. I want to learn about you. In fact, a quote that I read years ago from Stephen Covey in his book, 7 Habits of Highly Effective People, was seek first to understand before seeking to be understood. That's what a good doctor does.
Absolutely.
I would be rather concerned if I sat down with a doctor who within 11 to 12 minutes began to poke me with needles and push pills. And you need to know what is going on, and everybody's a little different. So the first thing we do is we schedule an appointment, we sit down with the consumer, and we learn as much as we can about their healthcare habits, okay? Do you live in Pennsylvania full time? Some people have a summer or a winter home in Arizona, a winter home in Florida.
Those are smart people.
Oh, they're smart people. But what does that tell me? That tells me that they're probably going to seek care outside of our community. Therefore, a plan that tethers them to certain doctors and certain hospitals like an HMO, probably not going to work well for them.
Because it's not going to be as effective if they're out of state, they're out of network.
No coverage out of network. Yeah. So things like that, prescription drugs, what I see happen oftentimes, and this is innocent, but it happens. Joe Blotz is turning 65. All of his buddies are on XYZ Medicare plan, and they're like, "Hey, you should get this one. It's working really well for me." Okay, but that isn't the way to do it, because if his prescription drugs, and they usually are different perhaps than what his buddy's taking. We need to know, does that plan's formulary cover these drugs adequately, right?
Because they're all different.
They're all different.
And as a provider, when I see a patient coming in that says they're not taking the medication, I ask 2 or 3 times, make sure they're not forgetting that they're taking something.
Bingo.
Because it seems that everybody's put on some type of medication.
Yeah, so that's what we do. We start with, just like a good doctor, why are you here? What ails you? What are the symptoms that brought you here today? Same thing. And there are some commonalities when people turn 65, they're aging into Medicare, they're usually leaving a group plan, and they're afraid. It's new. Anytime, change is hard for all of us, right?
Because everybody, when you turn 65, becomes eligible for Medicare. And Medicare
Almost everybody,
is a government agency.
That's correct. Medicare is a government agency. So we sit down and differentiate original Medicare, A and B, building a plan where perhaps we offer a supplement to that, add a drug card, dental, vision, whatever. We can build basically the same type of package that a Medicare Advantage plan offers, but we just do it with various components. And the advantage to original Medicare is they can pick any doctor, any hospital, anywhere in America.
Okay, so you just isolated 2 forms of Medicare. One is a standard Medicare, or the original Medicare. The other one are
Medicare Advantage plans,
which are generally HMOs.
Generally, HMOs or PPOs.
What's the difference between an HMO and a PPO?
An HMO is technically, it stands for a health maintenance organization, HMO, and they're very strict in that when you enroll in an HMO, you have to seek care in the network. You've got to use one of their doctors unless it's an emergency, or you're simply not covered. Okay, and that way they're able to control the cost, control the docs.
And that's something you have to know at the at the onset, because if you don't and you get stuck, you're responsible for that bill.
Yeah, you could put a dent in your weekend.
Yeah.
A PPO is a preferred provider organization, and it gives you a little more flexibility. It works best if you use their selected doctors, but it does give you coverage if you do not. They just penalize you. Okay, you're going to pay a little more if you're not using their doctors, right? Because they can't control the cost as well.
Okay, while we're talking about this PPO and HMO, if I'm a Pennsylvania resident and I've signed up for one of those two plans, and I am in Florida or I'm in Arizona and something happens as an emergency, am I covered?
Yes, if it's an emergency. But the thing that I have to clarify is who gets to decide if it's an emergency or not, you or the insurance company?
Well,
it's the insurance company.
That's an issue.
Okay.
Yeah.
So some examples that I think would be safe to say you're okay, is, let's say, again, a client enrolls in an HMO, which is very strict, and they're visiting the Grand Canyon, and unfortunately he or she has a heart attack and is rushed to the hospital. In all probability, that is going to be covered even though they're out of network, right?
A fall and break an arm.
Fall and break an arm, something like that. You have no choice in the matter. You're not selecting, they're rushing you to whatever hospital's available.
Kidney stone attack.
Yeah, you're probably going to be fine. But maybe something like a kidney stone, let's say, I wouldn't be as confident to say that they're definitely going to cover that out of network, okay?
All right, so you're out of state, you're on one of these plans that you're talking about, and you have a kidney stone attack. Do you have to get clarification from the insurance company before you ever do
I would
anything?
say in a kidney stone situation, I would probably pre-certify or call the insurance company to make sure they're going to consider that emergent care.
See, to me, that's emergency care, because you're in intense pain. You can't even walk with a kidney stone.
And you've been through it.
Yeah.
But that's where I said the challenge to managed care is you're not, at the end of the day, the decision maker is not the consumer. The people deciding whether they're going to write the check or not to cover you is the insurance company. And you have to understand, there's a reason these insurance companies are making millions and billions of dollars. They are for-profit companies, and somebody is at the executive table, they're managing nickels and noses, and they want to make sure that the company remains profitable. And again, understand, an HMO, a PPO, a Medicare Advantage plan, they're great plans. There's nothing wrong with them, providing that you understand what you're getting into, that it meets the consumer's behavior, it meets their needs, meets their budget. They're great ways to go. But we want to clarify up front, because I like happy clients, okay? We want to clarify up front. I'd rather take that hour up front and make sure they know beyond the shadow of a doubt the differences. And then typically we then send them on their merry way and go, think about this. Do you understand everything we've discussed today? Yes. Great. I want you to think about it. Here are two clear paths that we've laid out. And usually, Dr. Ed, what we'll do is we build from the ground up, meaning what? If they're looking at a Medicare Advantage plan, I'm going to know that their prescription drugs are all covered. I'm going to know that their doctors and hospitals, the ones they are using or want to use, are in the network of the plan they're selecting. So we take all of that guesswork out. And we can almost tell the consumer to the penny for the next 12 months what their drug costs are going to be, including the premium for that plan. But there are two distinct paths, and that is original Medicare or a Medicare Advantage plan. And the one thing that I want to stress to your listening audience is that a Medicare Advantage plan, when you are enrolling in a Medicare Advantage plan, such as Highmark's Community Blue or UPMC for Life or Aetna's Advantra Gold plan.
I have a lot of patients that are on that.
Oh, they're fine. Yeah. Nothing wrong with any of them. We have lots of clients on them. But you're literally opting out of original Medicare, and the insurance company is taking over Part A, Part B. The insurance company is, taking care of all of your coverage. It's no longer Centers for Medicaid Medicare Services. You're no longer in original Medicare. You can take your red, white, and blue Medicare card, put it in the drawer. You're never going to use it. You're relying strictly on that insurance
because
company.
They're receiving the premium from the government,
Bingo.
Not you.
They're receiving a stipend on a monthly basis from the government's trust fund to offset the cost of managing that consumer's care. That is correct.
So what are the biggest decisions that you to put this all together? Go with original or go with an advantage? What are the biggest concerns?
Well, again, we lay out the contrast of both. I would say to a consumer in closing, after we go through, both scenarios, I would say that if you're a consumer who freedom of choice is important, let me give you an example, all right? And again, God forbid that anybody ever hears this, but let's say, you have a couple that are on Medicare, husband and wife, and one of them receives a really bad diagnosis, okay? Whatever, you pick, pancreatic cancer, some dread disease. We have good care here in Pittsburgh, but from time to time, you will hear of certain doctors and certain hospitals, such as the Mayo Clinic, Cleveland Clinic, Johns Hopkins, I think Herman Memorial in Houston. There are certain areas of the country, certain doctors that seem to have a protocol that is getting better results than others, okay? With Original Medicare, you have the freedom to go anywhere you want, and I'm probably that guy that's going to get online and read and look and potentially consider outside of the box solutions, right? In all probability, with Original Medicare, I can go anywhere I want, from Maine to California. I don't have to ask permission, It's a freedom of choice approach. The other thing to Original Medicare, usually if people choose to stay in Original Medicare and buy a supplement, I recommend Plan G, as in good. And basically that consumer with Original Medicare and a Plan G, if they're hospitalized, they have no deductible, no co-payments, no co-insurance. In other words, everything's covered 100%. You pay nothing, Mr. Consumer. That's pretty good insurance. Complete freedom of choice, and you pay nothing. I don't care if it's $1 million bill, right? That's hard to beat. For outpatient care, Original Medicare, you have Part B covering that. With a Plan G supplement, the consumer, their only out-of-pocket for a year is $226 in 2023. So that individual knows beyond the shadow of a doubt that if they have any medical care, inpatient or outpatient, they can go anywhere they want, and the most out-of-pocket they're going to pay for a covered expense is $226 for the year.
What's the disadvantage?
Well, the disadvantage is that scenario is the most costly scenario, okay?
Because you're having to buy these supplements to cover drugs or to cover...
Yeah. But I must say that's risk management 101, right? The better insurance, the less risk I have, excuse me, I'm sorry to touch the mic, the less risk I have, typically the more you're going to pay for that solution. Medicare Advantage plans, which is weird, it's hard to wrap your mind around this, but there are some Medicare Advantage plans that if you're enrolled in A and B, which you have to be, by the way, for a supplement or Medicare Advantage, there are Medicare Advantage plans that are zero premium. That means you don't pay your Medicare Advantage provider anything, okay? And for some people who are relatively healthy, they don't see the doctor, they're not taking a lot of drugs or whatever, that might be the perfect scenario. All their docs are in the network, they get some extra goodies with the Medicare Advantage plan, the gym membership, vision, dental, yada, yada. Now, they're paying nothing every month, but that plan might have co-pays attached to every service that they use, every time they see a specialist, every time they go in the doctor. So they could have a year, doc, where perhaps they're paying, if they have a bad year, they might have up to $6,500 out of pocket.
Out of these $30, $50 co-pays.
So Joe Blotz over here is paying, let's say, with Part B, the supplement, their drug card, maybe he's paying $300 a month, or she. But they have the peace of mind knowing that they can go anywhere, and the worst case scenario in terms of out of pocket, $226. This person over here might not be paying anything monthly, but the potential risk of that scenario is if they do seek care, it could cost them $4,500 to $6,500 a year.
Okay, so there are a lot of that's a lot of information to make a proper choice.
Bingo, it is.
And that's why you need to talk with somebody like yourself or the people that you have in your office. You're hitting that that age of 65, which automatically says you should enroll in this, there's something called a penalty, I understand.
Right.
If you don't do it, you have like 3 months before, 3 months after. Is that what it is?
Yes. So when you age into Medicare, you have paid for Medicare Part A as a working consumer through payroll taxes, et cetera. Part A is already funded, doesn't cost you anything. So the decisions people have to make.
That's hospital care.
That's hospital care. The decisions that people have to make are, are they going to add Part B? And again, this is a government apparatus, right? And I tell everybody, unless you're a very unusual situation, you're going to want to add Part B. And on average, that's going to cost about $165 a month. You're going to pay that not to me, not to an insurance company. You're paying that to the federal government. Very often, it's going to come out of their Social Security check, okay? So now they're all set. They've got A and B, right? But then again, they're going to need to get in front of somebody like myself or a qualified, certified, licensed, well-trained broker who can walk them through this Medicare maze to help them determine, do they stay in original Medicare and build an apparatus so that they have the freedom of choice, very little risk, 100% coverage, or are they going to go into a Medicare Advantage plan?
So if you're a traveler, original is probably
better.
If you're healthy,
maybe the zero premium's great. We had a guy in the office the other day who, had a lot of physical ailments, right? Just a lot of severe illness going on, lots of prescription drugs. No doubt he's going to be in the doctor's office 5, 6, 7 times this year, right? And not just for small stuff. So it was clear to me, pay the extra premium, get the better coverage, because otherwise it is clearly you're going to be co-paid to death, right? You're going to be spending $4 grand, $5 grand, $6 grand out of pocket.
Interesting, there's an opt-in, opt-out period, right?
Yeah, so you have that 3 months prior to 65, 3 months following 65. That's this open enrollment period. There are also special election periods. A special election period might be, a gentleman, Joe Blotz, is turning 65, but he continues to work at his companies covered by a group plan until maybe 67. Well, that's fine too, because as long as you're covered under a qualified group plan, then there's no penalty. But you do want to take advantage of enrolling in Medicare Part B and enrolling in a drug plan within that time frame. Or if you put it off and then seek it in the future, you could pay a penalty, a small penalty, on your drug card for the rest of your life.
Meaning it cost you more.
A little more.
So we're at the end of the show, Tom. So we're in that period right now where it's sign-up period.
That's right.
And that runs from when to when?
October 15th to December 7th. Yeah, that's called the annual election period. This is when everybody gets to move laterally. You can, maybe your plan's not serving you well.
That's a sure little window.
Short window, and it's a lot of work for us, man. This is game time.
Yeah, but they work hard. I know these people at West Penn very well. They work hard there, and they look out for you.
Thank you.
They're not worried about that dollar. That dollar comes the harder you work, right?
Yes, it does.
Yeah. West Penn Life and Health, give them a call. They'll help you out. And if they can't, they'll find someone who can,
That's right?
Yeah. Remember, a healthy pet is a happy pet. When you're healthy, you're happy as well. You can listen to me live every Saturday morning, AM 1250, The Answer, 9 a.m. to 10 a.m. God bless. We'll talk to you next time.